And now it's Boomer Life. Lifestyle ideas designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation. This is Boomer Life.
And good morning, it's Tom Lucas back again. Today, our very special guest in studio with us are Dr. Bobby Birdie. Good morning, Dr. Bobby Birdie.
Good morning.
Dr. Ron Zokol, good morning, sir.
Good morning, Tom.
Nice to have you guys back in studio with us.
Thank you.
Now, it's springtime. First weekend of spring. People are thinking about selling houses. They're thinking about maybe getting their teeth fixed. But before we go on, I want to ask you about this dream I keep having. I'm sure we've all had it before, but you know how some people dream that sometimes you're losing teeth? I have this dream, this recurring dream that I'm losing a whole section of teeth. Like a whole at once, and there'd be like 5 or 6 teeth together. Is there something strange going on there, do you think? Or
I don't know. I think you probably just need to want to be worried or feel guilty about not cleaning enough or brushing or flossing enough.
Okay, good point. Because that could happen if you don't brush enough.
Absolutely.
It's springtime here. People, again, like I said, are thinking about maybe putting their houses on the market. They're thinking about getting their smiles fixed up. They're thinking about going to see you folks over at BC Perio Dental Health and Implant Center. What would be some of the biggest drawbacks? What would people be concerned about first before coming to see you?
I would think that money has an awful lot to do with it. Because if they realize that they are in trouble at all and they appreciate the cost of doing it, that's why getting rid of their house or selling their house provides sufficient funds to be able to invest in the health factor. But there's that. There's also the pain factor. And unfortunately, that's a misconception more than anything else. Between the cost and the discomfort factors, I see that as a primary.
What about the needle? Are people still afraid of the needle?
I think that's the number one thing to me. I think that a lot of patients come in, they're afraid of the needle. They're afraid of the needle. They've got to kind of work themselves up because they're going to have the needle done. I think that's a big deal. The anxiety and how long they're going to sit there for a while is also an issue. And I think, we can provide things like either inhalation or oral sedation or different types of setters that can help you with that. And that really helps to kind of take the edge off for a lot of patients. It's something that really helps to kind of keep them at ease. That being said, it's gone are the days where people have horror stories about, remember when my dentist put his foot on my chest and I get this tooth out, or all these horrible things. And, those days are gone. We do things in such a minimally invasive way now. And we're using lasers and microscopes and magnification and things that are, minimally invasive. We're not doing things like they used to. So it's quite a different thing. And most of the fear I find is from when they were kids or when they were younger, they had a bad experience and that's what's happened. So normally we can get past those things pretty quick.
I think, too, the people that grow up as children and they have these fears, they keep them right through their adult life. Yeah.
Absolutely.
And let me tell you, these guys with the needles are great. I mean, most dentists these days are pretty good with the needles, right? And it's not so much the needle that might just tweak you a little bit. It's the stuff going out of the needle into your face.
Yeah, it's that.
Yeah.
That's
Nice way to put
well,
it.
that's a great way to put it. It's the liquid or the anesthetic that when it goes into the tissues, it's that expansion of the tissues that gives you the pain. And it's about doing that in a slow, in a prolonged fashion, and just kind of going about it in a way so that it's a bit more comfortable.
Yeah, it's a technique thing, really.
Yeah,
And therefore, people who are a little more sensitive to the patient's concerns and such will take a little more time and be significantly less uncomfortable.
Well, I've been practicing on an orange. I thought I could come down and maybe lend you guys a hand one day. So people come to see you, and of course, your consultations are free. We haven't mentioned that in the show yet, but your consultations are free. They cost absolutely nothing. They sit down in the chair with either one of you gentlemen, and what sort of things do they talk about? What do you ask them? What do they tell you?
I think we sit down and we discuss kind of their oral health in general. We want to make sure that they can tell us anything that's going on. Because typical questions we ask is, are there any concerns in your mouth right now? Are you having any pain? Are you missing any teeth? Is there any kind of issue that we want to make sure that whatever we're going to do, we want to address your concerns and what you're most concerned about first, because that's motivation. That's what you want to be there for. And then from there, we do a thorough examination and take our records. Normally involves a cone beam CT scan. It's just great 3D imaging. And then we sit down and we make a plan and we give you options. And, no treatment is always an option. And we'll sit down and discuss things and you'll get an estimate. And that's how it works every single time.
I like how you said sometimes that no treatment is an option.
Yeah.
Yeah.
There are numerous times. Some of those referrals even I get, or sometimes I'll get a patient come in and they think that they need the world done. And we'll sit down and say, well, you really don't. Everything looks pretty healthy and stable. We need to get you cleaned up a bit more with our hygienist or have your hygiene be a bit more, frequent. And then do a little bit less. And that's really nice.
I know a person, I speak from personal advice and experience here. I know a person came in to see you some time ago, and they swore up and down that they should have this certain tooth out, and you didn't think that was necessary.
Absolutely.
Yeah.
Absolutely. There's certain teeth that we as dentists, we're trying our very best to save as many teeth as we can. We do a lot of implants and we replace a lot of teeth as well. But we want to save teeth first and foremost, and we're not in the business of taking out teeth that don't need to be taken out.
That's a good thing. So now, if somebody would like to get a hold of you, let's give you have 2 locations. One's in Vancouver, the other one's in Coquitlam.
That's right.
The one in Vancouver is at 777 West Broadway, so that's at Broadway and Willow. Easy to find, lots of free parking. Well, it's not free, but there's lots of parking around there.
Yeah.
And if you don't have too much work done in your mouth, you can always go shopping and have a nice lunch after, right down there.
Absolutely.
So your telephone number in the Vancouver office is 604-872-0222. That's 604-872-0222. If you're in Coquitlam, the address is 1175. It's number 250, 1175 Johnson Street. And the telephone number in Coquitlam is 604-936-8244. 604-936-8244. Our guests on the air all the time with us, Dr. Bobby Birding and Dr. Ron Zokol, but you have a few other dentists that work with you.
Absolutely. We've got 2 other dentists that work with us right now. Dr. Peter Munns, who's a certified periodontist, who's been in the community for a very long time. And then we have Dr. Josh Kleiman, who's also a certified periodontist and periodontal specialist, who's worked with us as well, and he's been around for many, many years as well. And Dr. Tim Gould, who's with the association and has been working with us for a while and just recently retired. I always say his name because he's not that far gone yet, so I want to always mention his name because we have a lot of respect for Tim Gould.
Well, now I know that Dr. Zokol was happier than a pig and you-know-what for many years over there in Cambie Street. So how did you manage to get Dr. Zokol to move over to your office and get these other dentists? How did you put all this thing together? Because it sounds very fascinating.
Well, I had to be really nice and coerce him. I bought him a bottle of wine. It was pretty difficult, I'm not going to lie to you. It was not easy. Lots of meetings. I don't know. I had to wine and dine him quite a bit.
Free tooth whitening?
That's right. That's right. I promised I would let him do dentistry in the office. It'd be great.
I asked you just a second ago what people talk to you about when they come in for their free consultation, and you told us, what about after the work is all done? What kind of things are they saying to you then?
It's a matter of how often do I need to have my teeth cleaned, how much of a recall do I need. If we're working with someone who's referred to our office, 9 times to 9.5 times out of 10, they're going back to their general dentist for their recalls and their maintenance. It's only once in a while that if someone's got a very advanced case that we discuss that with the referring office and whether or not we can share that maintenance just so that a specialist looks at the patient once in a while. When people come to our office directly, then we are able to maintain them, or else we'll find a general dentist in their community to help them be maintained.
And you're not just fixing teeth in a person's face, you're actually fixing their lifestyle.
Very much so. And when people come in, we take a look. We don't look just at their teeth, and as you point out, we take a look and say, okay, what's in their best interest, given their priorities? Say, how do we help them have a better life? And unfortunately, it just happens to be that teeth are an important factor in that.
Well, absolutely.
So we help them from that perspective. But some people aren't candidates for a lot of different reasons. They may want their teeth, but if they have medical issues that supersede their dental needs, then we make sure that that's managed before the things like the dental needs are there.
And the most important thing that you said, I remember on one show a few months ago, you take care of the pain first.
Well, yeah. I don't know about you, but I have a hard time making an important decision if I got pain somewhere else.
I'm glad we're not on TV right now. But pains in your teeth could cause pains elsewhere too.
I need to think of where.
I know I've seen a lot of people coming out of your office and they're finished their treatments and they're talking to the receptionists and the ladies at the front desk. And they're just so happy because they're saying things like, now we can smile, now we can eat. And I guess if you have false teeth or bad teeth, eating is a difficult situation.
Well, I've had patients, I think we've all had patients that have found that they couldn't eat properly because of pain in their mouth or the lack of teeth where they couldn't chew properly. And I've literally had patients who were diagnosed as malnutrition patients by their physician. And it was only when they had their teeth rebuilt that they gained more weight and got back to healthy.
So they, I guess, couldn't eat because of their teeth.
That was the problem.
And once again, your teeth are affecting your entire health of your whole body.
That's it.
For goodness sake, the things we learn on this show. I'm glad you guys came by. If you want to get some more information, if you'd like to talk to one of the doctors, if you want to make an appointment for a free consultation, the telephone number in Vancouver, 604-872-0222. 604-872-0222. In Coquitlam, the telephone number is 604-936-8244. That's 604-936-8244. It's the BC Perio Dental Health and Implant Center. Our guests in studio, I'd like to have them around because I learned lots about teeth. Dr. Bobby Birding and Dr. Ron Zokol, and we're coming back with more right after this.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on AM 650.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at ShannonOaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
Missing teeth? Don't want dentures anymore? Not happy with the way your smile looks? Dr. Ron Zokol can help. As an internationally recognized authority in oral implantology, Dr. Zokol is dedicated to all your dental care needs and can help solve your dental problems and help you achieve optimum oral health. Book your free consultation or learn more at drzokol.com. That's DRZOKOL.com.
CI 650.
Oh, the shark, babe, has such teeth, dear, and it shows them pearly white.
Oh, yeah. The shark has such teeth, babe. He shows them pearly white. Oh, you like these dentist songs, don't you?
Yeah, white teeth are good.
White teeth are good. Healthy teeth are even better, right?
They are.
Yeah,
If they're
that's
white
right,
and healthy, they're even best.
Hey, I digress for just a second, but the big thing now is tooth whitening.
Sure.
Do you think this is a good thing, not a good thing, safe thing, not a safe thing?
I think everything is okay in moderation.
Okay.
But every single time you do any kind of bleaching of your teeth, you are doing something to make them white, and normally that's involving some sort of a chemical.
Are you doing something to the enamel of the teeth then? Are you making it thinner?
Yeah, I would. Ron, you can take this one.
Yeah, this is quite. This harbors a lot of discussion, and I've known people who have whitened their teeth quite significantly. I don't think there's any huge evidence that says it changes the tooth so adversely that it causes you a problem. And from that perspective, and I've never had any evidence to the contrary. My sister, who's a dentist, has whitened her teeth like crazy, and this is gently over many years, and her teeth are incredibly white, and they're natural. No restorations, and she's been stable. Being a dentist, she ought to know.
You would hope so.
I would hope so, indeed.
Did she go to the same school as you?
Yeah, she did, actually. Absolutely.
When I was in to see you, Bobby, we talked a little bit just quickly about toothpaste. You said there's some toothpastes that are good, some are not so good. And just don't give any names or anything, but what's the best type of toothpaste for a person to get?
One that has, one that's not abrasive. So try to get one that doesn't have a lot of abrasive types of materials or ingredients in it. And get one that's, the whitening types of toothpaste, no matter what kind they are. Normally they either have more abrasives, or the reasons why they're whitening type toothpaste are because, if you look at the nomenclature, it's because they clean your teeth, which makes them whiter. So, in all honesty, I would say in general, you look at the labels of things, look at them carefully, read them, and don't get them just because they think it's going to be this or that. You want to get a toothpaste, and I think the very best way to find out is ask your dentist and talk to them about it. But I just use a normal toothpaste, you know what I mean? And you don't need to use a lot. That's the other thing too. Toothpaste itself is a very abrasive type of thing, and we're seeing that, as a periodontist, you see a lot of abrasion of root surfaces and tooth structure from toothpaste.
So I've heard about use the size of a pea. Is that about right? Or?
I would say even a little bit less than that.
Really?
Yeah.
It lasts a hell of a lot longer. That's true.
No, interestingly enough, when many years ago, we were advised that the science in the concept of toothpaste was rather interesting, in that a study was done where various toothpastes were evaluated, along one of them against a standard which was water, and they found that the most effective cleaning was actually done with water.
That's right.
Wow.
So
it's amazing.
It just doesn't freshen your breath a whole lot.
No.
That's right. So whenever I tell my patients, I said, toothpaste is fine if you want to use some. Just don't use a lot. You don't need a lot. And I have some patients that will dip their toothbrush in mouthwash instead of toothpaste and then use that if they just want that fresh feeling, because it's the abrasives in toothpaste that can cause tooth wear, cause recession if you're vigorously brushing, whereas a toothbrush itself dipped in water is going to clean as well.
You talk about the abrasiveness, and I remember great-granddad being around. He would say, you take a match, you light the match, you take the sulfur that's left over, the charcoal, and you brush your teeth with that. I used to think, I don't know about that. Number one, it doesn't taste too good. Number two, it couldn't be doing good things to your teeth.
No.
Yeah. And I've seen people wear not only their natural teeth down, but I've watched people who have dentures or implant-supported plastic teeth who are very, very aggressive with an abrasive toothpaste and a hard toothbrush, and they have worn a massive amount of tooth structure or plastic away. It's incredible how much damage was done.
Now, people come in to see you. Let's say they have false teeth, and they're thinking, can we improve upon this? So they sit down with either one of you gentlemen. You have a look, and then how does that proceed? What do you say to them? I guess it depends on whether they can have implants or teeth in a day. Or
Oh, sure. And this goes to the evaluation. The comprehensive examination is absolutely essential for everybody. Everybody comes in with a different set of criteria, or concerns, or conditions which would direct us in one path of treatment or another path. And there is no commonality there. It'd be reasonable to say that if you have no teeth, we have a solution. And apart from people who have are medically compromised with conditions that would not allow them to heal, we can generally do something to help those people much better than where they are right now.
let's talk about teeth in a day. And I keep saying to you, and I always play the devil's advocate, but you can really do teeth in a day for people?
Yeah, we did it,
Regularly.
this week 3 times. So, yeah, we do it all the time. Every week we're doing teeth in one day or teeth in a day, whatever you want to call it, all in 4. There's lots of different names for it. It's my favorite service to provide right now. The reason being is because you meet a patient or whoever it is, you discuss treatment with them. It's one appointment where you just take some records, and then it's showtime. And the next time you see them, you're going to change the way they look and smile and eat in one day. It's pretty amazing stuff.
I think we got to go somewhere else, Bobby. We got to talk about teeth in half a day. Teeth in the morning, because that's what's actually happening. That's what's actually happening. We're doing the surgical procedure and giving them teeth within about a 3 to 4 hour period. Finished.
Yeah, it's getting to a point where we're able to do 2 of them in a day, and sometimes 3, depending on how it goes.
So I was going to say, I could come in the morning, and then I could bring my wife in the afternoon. You could.
Yes.
Really?
Yes.
Wow.
Yes.
Bringing the kids the next day.
Yeah, we call it teeth in one day because it's done in one day, and that's quite enough. But we do more than one in one day. And sometimes we'll do someone's upper and lower teeth in one day as well.
Wow.
So it's a fabulous service. It's a great service, and we do it not just with implants and plastic teeth. We do it different ways as well. So there's lots of ways to do it, and it's my favorite service to provide right now because you change the way someone is able to eat and function and look every day.
When you really think about it, if we're taking somebody with a lot of natural teeth and the odd tooth missing, you put an implant in, the rehabilitation of all of that takes a significant amount of time and a significant number of appointments. And you go from poor teeth to completely rebuilt, beautiful, and the comparison is dramatic. But when we have teeth in a day or teeth in half a day, whatever it is, that happens within an hour or 2, or 2 hours, 3 hours. And you still have that very, very dramatic change in somebody's perception on what they look like to other people. They take a look in the mirror and they're just blown away by the improvement in how they look.
You know what I like about you guys is you guys have been doing this for quite some time. I won't ask how many years, but I know you've been doing it for quite some time. But the thing is, I ask you a question about dentistry and about teeth in an hour, teeth in a day, implants, and you get so excited about it. But I'm happy to see that. That's good. You have a passion for what you're doing.
It's funny. My assistant and I did a procedure Thursday. Oh, no, it was yesterday. And at the end of the procedure, she was more excited about it at the end of it than I was, and I was pretty excited because it was something very advanced, very difficult. I can't get too much into it, but all I can say is that that's the kind of the attitude, the atmosphere we have in our office. Is everyone is on the same team. Everyone really wants everyone to do really good work, and more than anything else, we really want to provide the best service for our patients. We want to make sure that you come in and you leave happy, and you're satisfied, and you get what you want.
Well, you did some work for me, and mind you, granted, it was a small job, but and I thank you for this. I'm very, very, very happy with what you did for me. But it's so funny, folks. I'm sitting there in the chair, and Dr. Birdie's working on me, and Dr. Zokol comes by and goes, "How are you doing there, buddy?" And when you finished, I wanted to have a look, but you kept saying to the nurse, "Look at this, this is great." And the nurse and the doctor just kept looking. I didn't get a chance to see it until I got home. Passion's a good thing, and you guys do have it.
Yes, absolutely.
And I guess all the other dentists, of course, they have it too.
They do. It's a great place to work. The docs, all of us doctors, we sit in one room where we don't have our separate offices. We actually have just one big communal room. So with the one benefit of our office being a multi-specialty, multi-doctor office, is that there are numerous times where I'll pull Dr. Zokol over to look at a case and get a second opinion, so we can getting more than one doctor, more than one specialist in an office to look at things is so beneficial, because everyone has different experiences, different skill sets, and also just what they've done is quite different. And they might have a different viewpoint or a different way to go about something, and it really allows the patients to get the very best service.
Well, I remember when I was waiting for you, you were down the hall doing something, and Ron came in to see me. He says, "Hey, how you doing? You're looking a little pale today." I go, "Oh, gee, thanks." No, just kidding. But you've got a fantastic office, and there is no reason whatsoever for anybody to feel a bit nervous when they go to see you. I'm sure it does happen, but once they sit down in the chair, you guys have a way of calming them down.
Well, yeah, we just talk to people. People are people. People want to be talked to. You want to be related to, and I don't like being I'm the doctor, you're the patient person. Mm-hmm. I like talking to you, because that's the best part of the job. Dentistry is great and everything else, but getting to know people and getting to know them and every day seeing what they're like, that's the best part.
And I guess you want to learn a little about their lifestyle as well and what they do, and
absolutely,
all that's important.
Absolutely.
Yeah. So it is the weekend. People like good things on the weekend. So let's tell them this, because it is the weekend, and this is a weekend offer only, folks. But if you call Dr. Birdie or Dr. Zokol at their office today, or leave a message, or maybe Monday, they can get a free consultation, right?
They do,
because it is the weekend. So they book the appointment. They call this number, 604-872-0222. That's the Broadway office, 777 West Broadway at Willow.
Yes.
604-872-0222. If you live out in Coquitlam. You know, you're there, what, a couple of days a week in Coquitlam?
Oh, yeah. Yeah,
Okay.
we have doctors there 3 days a week.
Okay.
Yep, absolutely.
The address is 1175 Johnson Street. It's Unit 250, 1175 Johnson Street. Telephone number there, 604-936-8244. In Coquitlam, 604-936-8244. When you first started this dentistry career, did you ever think you'd be on the radio with talking about this?
Oh, heavens, no.
No, really?
I never thought I'd ever be on the radio until I met this guy. So
that's three of us. But I'm so glad you guys come by and grace our studios once a month. It's so nice to learn about what's new and exciting. Are there new things down the pike coming in the world of dentistry, do you think?
There's some of them.
Such a rapid rate. I mean, here we go again. That's right.
We could do a dozen shows on this. All I'm saying is that right now, on the minimally invasive, the computer guided, and the amalgamation of digital, and some of the new materials, and we're on the edge of that right now. We're incorporating all those new things all the time. It is a great time to be a dentist.
Ron, give us a little hint. Make something up. I don't know, but just make something up. In the next 5 years, what do you think we could look forward to? A guy goes to the dentist, a woman goes to the dentist, and things will be a little different.
I think the technology will allow the majority of people who are placing implants, if they can afford to get to the technology, that they'll be able to come into an office as ours, have a CT scan done, have an examination done, have everything planned right then and there, and have the implant placed with precision. And that's something that takes time and a lot of organization to do today, but that will be able to be done within minutes in a future office. Mm-hmm. And I took a look at a program. There's a company that had what we call active navigation. So you're watching a screen, you have an image of the patient's jaw and what's going on exactly and proportionally correct. And as you watch the screen, it is actually guiding the position of the burr that you're using to put the implant in its perfect position. And as you are drilling into the bone structure, it's showing exactly where you are anatomically, three-dimensionally. So you can place it absolutely dead perfectly without any troubles at all.
Will the day come, or is the day already here? Please forgive me if the day is already here. I don't know these things. That's why I asked this question. I know that doctors that deal with the human body, one could be in New York, another doctor could be in London, England, and they could do an operation together by using technology. What about dentistry? Is that day here? Is it going to come?
I think, I'll be honest with you. I think that day, it could come very soon. Yeah. I think that whole aspect is going to be quite different, but I think it's possible. There's more and more streaming and technology and getting involved. I think it's absolutely possible.
And I think so. And one of the things in medicine that's very actively done remotely is radiographic analysis. So somebody has a CT scan or an X-ray done, and somebody in a remote location could be sitting there, see the picture almost instantaneously, and give a report from a radiological perspective.
Wow, that's exciting.
So it reduces the need to travel. and reduces the time factor, increases the accuracy, increases the rate of diagnostic information that's available, and therefore treatment potential. So I think it's not inconceivable to do that. I think in dentistry, for the more complex situations, we just don't have that many, I think, that pertain to that level of information requirement. But that whole concept of being able to move information over long distances electronically affords a great deal of opportunity.
Oh, absolutely.
Yeah, I think this is all going to boil down to things being more accurate and things being much, much quicker.
Good stuff. You guys going to stay around for a little while?
Absolutely.
Okay, I'll get something to chew on this. It's 11:31 is the time. You're listening to the radio. No, I do the radio real estate show before this one. This is Boomer Life. And today we're speaking with a couple of gentlemen from BC Perio Dental Health and Implant Center, Dr. Ron Zokol and Dr. Bobby Birdie. The telephone number in Vancouver, if you'd like to make an appointment for a free consultation, because it is the weekend, and we're going to make this free for this weekend, folks. 604-872-0222. That's the telephone number to the Vancouver office. 604-872-0222. They're located at 777 West Broadway in Vancouver. In Coquitlam, it's number 250, 1175 Johnson Street. Number 250, 1175 Johnson Street. The telephone number in Coquitlam to call for BC Perio, 604-936-8244, 604-936-8244. I'm Tom Lucas. Dr. Birdie and Dr. Zokol are coming right back after this.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at ShannonOaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
Missing teeth? Tired of your dentures? Not sure which dental solution is right for you? Dr. Bobby Birdie can help. A certified specialist in periodontics and prosthodontics, Dr. Bobby Birdie can show you your options and assist in determining if dental implants, teeth in one day, or implant-supported dentures are right for you. Book your free consultation at bcperio.ca. That's bcperio.ca. Find your dental solution with Dr. Bobby Birdie and Dr. Ron Zokol. bcperio.ca.
CL 650.
Yeah, like Diana Ross says, I get up in the morning, what do I do after I wake up, have my coffee? I brush my teeth. Is that good?
That's right.
Is it cool to have a cup of coffee? Can I have my cup of orange juice first before I brush my teeth? Or what is it best to get up right away and throw some cold water in my face, then brush my teeth?
You ever tried brushing your teeth or having a glass of orange juice after you brush your teeth?
Good point.
It does not taste so good.
So I think as long as you brush at night, you can brush after your breakfast.
And should people brush 3 times? I guess you could just brush as many times as possible, but I guess, what, 3? No?
You don't want to do more than 3, I think.
Oh, really?
I've seen people get really abrasive with their teeth and stuff, so there's a good little kind of equilibrium there. You want to keep it around 2 or 3.
Would you call my mother after the show and
Sure.
tell her, please?
No problem.
Mom, I've got the dentist on the phone. He says I don't need to do it more than 3 times a week. There's a good question for you. At least I think it's a good question. Let's suppose somebody is working with their regular family dentist, and the dentist thinks that they need a little more help than he or she is able to give in the local office in Ladner there. Can they make an appointment? Can they get a referral from their dentist to go and see you folks?
Oh, absolutely. We are a referral-based office as well, and we have a lot of general dentists and a lot of other the types of medical practitioners that we work with directly, where we work on and treat patients together. Sometimes it's referrals for us to provide all treatment and send back, and sometimes it's for us to provide part of the treatment and help treatment plan maybe the case, and then work in collaboration with a patient's normal family dentist. So we love those relationships. Those are our favorite ones because I love working with our colleagues and spending that time and and really working together so that our patients are really well taken care of.
So you would work with the patient and with their family dentist, not against them.
Absolutely.
That's right.
Yeah, absolutely.
Rod, let me ask you. Let's suppose that somebody doesn't have a dentist. I don't know why, but let's suppose in 2015 somebody does not have a dentist. Can they still make an appointment with you at BC Perio?
Oh, absolutely, and we'll help them find a general dentist, and we'll find out where they are, what area of the city are they in that makes it convenient for them, and we have contacts all over the place. We'll also be able to identify some of the needs. So if somebody's needs are beyond what normal general dentistry allows, we can help guide them in the right direction for treatment there if it's not something that we would do ourselves.
Do you get more females or males coming through the front door?
I think probably if you did the numbers really accurate, probably a few more females than males.
I think so too. I think because the female, God bless her, is probably the caregiver of the family, and she will come in on her own and then drag the family and yelling and screaming and kicking, right?
Yeah, far too often the men are so-called too busy.
Yeah.
Oh, really? That's a good. Let me write that down. Sorry, dear. Too busy to see Dr. Zokol today. I see. So they come in again for their free consultation. They sit down in the chair. We mentioned technology a second ago, and you mentioned the CT scan. That is a little bit different than people would say, I got an X-ray.
It's a whole heck of a lot different. A CT scan is a three-dimensional image. So what ends up happening is you take an X-ray of something. We're taking an X-ray of all the different layers, kind of all layered on top of one another onto one piece of paper. Whether it be a film is still a piece of paper, or a piece of single two-dimensional image. A CT scan is something that spins around, takes an image of everything in 3 dimensions, and then we look at it on a computer. And we can look at it so that we can look through all of it in 3 dimensions. So really not much gets missed. It's pretty amazing.
So it really helps you do your job.
Well, we do it for every single patient that we do anything significant for, and which for us is significant is a single implant. So every patient gets it, and the reason being is because we want to make sure that we have absolutely the most amount of information that we would have to provide the best and most accurate service.
And am I correct in thinking there's a lot less radiation in the CT scan than there is with a regular X-ray?
Yeah. And I'm glad you brought that point up, because what Bobby is saying is quite true. In the past, though, in order to get that kind of information, the radiation exposure has been quite dramatic. And if you compare and contrast with medical CT scans, the amount of radiation that is exposed to the patient is vastly different. And in fact, on Thursday, I saw a lady who came in who had a lot of CT scans done for cardiac reasons. Now, that's getting pretty the upper part of the body, so you're concerned, and she was rightly concerned about the amount of radiation she's receiving. Therefore, if it wasn't necessary, why do it? But when you realize that the amount of exposure to get this information is so small, it's almost insignificant in comparison to, let's say, a CT scan from a medical device. The dental cone beam CT scan technology, and particularly the one that we have at BC Perio, has the least amount of radiation exposure of any instrument in the world that we understand. So the value is to get as much information as you can without exposing the patient to a lot of dangerous radiation.
It's less radiation than 1 or 2 normal dental X-rays.
I remember going to the regular dentist as a little kid, and they put the thing in your mouth, and then they put the thing over top of your the lead vest or whatever, and then everybody would run out of the room and leave you in there. I'm going, hey, where are you going?
That's the reason.
This
stuff is accumulative, and of course, everybody has badges to make sure the dosage of radiation is monitored, and we make sure that nobody is overexposed.
That's what those badges are.
That's what they're for.
We have to make sure that our staff is protected and they do well.
That's a good thing. So you make sure your staff is protected, and of course you make sure that your patients are protected.
Absolutely.
Yeah. So again, people don't need a referral from their dentist, but if they want to get a referral, they can do so.
Yes.
If they don't have a regular dentist, give you guys a call. You can line them up with somebody.
Well, essentially, everybody's welcome, Tom.
Well, you let me in, so everybody must be. Not only that, they've got a fantastic location in Vancouver. I haven't seen the Coquitlam office yet, but I want to get out there one day and have a look at that. But I know your Vancouver office is wonderful. Your staff is just out of this world. They're such nice and accommodating people.
They are great.
I think you guys handpicked them, didn't you?
Well, for sure.
Especially the good-looking ones. Just kidding.
Oh, you're a bad man, sir.
I know, and I can't change now. I can't help it. So if you'd like to pay them a visit, I'm sure that you would maybe make an appointment and take them on a little tour.
Sure.
Because your offices are fantastic. The address in Vancouver, 777 West Broadway. That's 501. You get in the elevator, you go up to the 5th floor, and doors open. There you are, 777 West Broadway. Telephone number 604-872-0222, 604-872-0222. In Coquitlam, it's number 250. The address is 1175 Johnson Street, 1175 Johnson Street. The telephone number is 604-936-8244, 604-936-8244. The gentleman on the show with us all the time, Dr. Bobby Birdie and Dr. Ron Zokol from BC Perio Dental Health Implant Center. And what I like about you guys, I said it before the show, but I'll say it again, you're so enthusiastic about what you do. You enjoy helping people.
Very much.
Yeah.
I would be retired otherwise.
Would you really?
If I didn't enjoy
what would you do? What would you do if you were retired? I don't know what you'd do.
I'd probably be looking for a place to get back into the field.
I think so. We've got more with Dr. Bobby Birdie and Dr. Ron Zokol coming up in just a second right here on CL 650. It's Boomer Life.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CL 650.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
Missing teeth? Don't want dentures anymore? Not happy with the way your smile looks? Dr. Ron Zokol can help. As an internationally recognized authority in oral implantology, Dr. Zokol is dedicated to all your dental care needs and can help solve your dental problems and help you achieve optimum oral health. Book your free consultation or learn more at drzokol.com. That's DRZOKOL.com.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at shannonoaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
CL 650. Smile, smile, smile. My baby's got a beautiful. After breakfast, lunch, and dinner each day, brush all that food away. Listen what your daddy say. Got to fight tooth decay.
Yes, sir. You've got to fight tooth decay. That's what daddies say. Daddy, right?
Who wrote these songs?
I don't know. But they're not bad. I think they're probably geared toward maybe a little younger audience than we are. But you know what? I figure we're all kids at heart. We'll be that way forever, and it's never too late to start taking care of your teeth. That's what I say.
That's true.
Is it true?
It is true.
So let me just, it just came to me now. Let's suppose that somebody's maybe 45 years old. For some reason, they've never been to a dentist in their life. God bless them. So they come and see you. Can you maybe set them on the right road? Maybe they don't even need treatment, but who knows?
Yeah, every now and then you come across somebody who doesn't attend a dentist regularly. You'll look in their mouth and everything's clean and beautiful and healthy. That's a rarity, but it does happen.
It's not the norm. You know, even this past week was a clear example of a patient of mine who hadn't seen a dentist in 5 years, and they come back and it's little tiny things on every single tooth that just could have been maintained and fixed along the way, and you know, needs cleaning real bad. And it's not that he didn't brush and floss along the way, he did, but even if you're really good with oral hygiene, seeing a hygienist and a dentist for a checkup and cleaning, you know, at least once a year, I think is pretty much mandatory. I think it's a great idea. The reason being is, no matter how good you are, you can't see and find everything, and you won't be able to really look at everything yourself.
Yeah. And interestingly enough, studies have shown that people who attend on a regular basis dental office every 6 months spend less on their dental health over the course of a lifetime.
Makes sense.
Than if they don't show up and then have to repair the damage that was created.
That makes a lot of sense. As you know, there's always a lot of new people coming to the show, and they're hearing you for the very first time. We've talked about this before, dental implants, because that's what's another one of the things that you folks are famous for. Let's talk about some of the benefits of dental implants for just a second.
Oh, how about just replacing a tooth that's been lost to do what? I would say eat better, keep everything in your mouth stable and into a position where they're not going to deteriorate, stop teeth from moving around, reduce the forces on the remaining teeth in your mouth so they last longer. How am I doing so far, Bobby?
Keep going. You're on a roll. You're on a roll.
You're up to a B minus. Keep going.
You're on a roll. You're on a roll.
Let's just say that there is no good reason not to put an implant into an area that's missing a tooth, because everything suggests that if you leave it alone and don't treat it, that repairing the consequential changes in the mouth would be more expensive than if you'd just gone and done it in the first place.
Yeah.
So I'm just going to say one thing about this, because I have this question every week, and where a patient comes to me and I sit down, look in their mouth, and they are missing a tooth. And I say to them, well, there's different ways to replace this, whether it be a partial denture, a bridge, or an implant. And I get it every week where they say, well, I was told that I don't have enough bone for this implant. I don't have enough bone, or I'm going to need a graft. What I want to let everyone know is that, grafting procedures of whatever type that we need to do. First off, with a cone beam CT scan, every week there are times where people come in and they think they're going to need a lot of grafting done, and we're able to do it with very minimal amounts of grafting because we have taken such amazing measurements and we can see and plan things thoroughly. But secondly, grafting itself is not like it used to be. It's a very minimally invasive, pretty straightforward procedure that's just run of the mill for us. It's something that we do every day, all day, and nothing in terms of that should deter anyone from getting an implant, because by grafting we're increasing the amount of bone you have there. It's not an increased amount of pain most times, and it allows you to get that tooth replaced and kind of replenish and rebuild what was lost. So that's just a little bit of a soapbox, but to be honest with you, that's what I deal with every week, and it's one of those things where come in and ask the questions, get the information, and you'll really be surprised, I bet you.
So the new implant, is that grafted then to the bone, or?
Yeah. So the bone that we put in is, a lot of times comes out of a bottle. It's not even something that we don't have to take it from you. We could if we want to, but it doesn't necessarily have to come from you. And whatever we put in next to the scaffold, your body replaces it. So it's something that's pretty amazing.
Yeah. Let me talk on that point just a wee bit, because the reason that Bobby is talking about here, that people get this information from a dentist saying you don't have enough bone for an implant, is likely to a large degree because of what was happened when they had the tooth removed and how it was removed and dealt with. The way we do things today, if the dental practice is strong enough in their experience and technological training and such, is that you take a tooth out, you should not lose any bone volume. And if you do that, then you don't have to rebuild it later.
Okay.
And so what we do when we take a tooth out is absolutely essential. What we do is we use a patient's own biologics, the platelets. We take their blood and we use that to graft, to replace that place where the tooth came out of, so that it builds back perfectly into form, and that when an implant's placed, it's very simple, it's done very accurately, and with the greatest amount of longevity and aesthetics.
I wish we were on TV right now, because your face is just beaming talking.
Well, it's true. The thing about it too is, and Ron, correct me if I'm wrong, but I haven't come across a patient yet that I can't do implants for.
Really?
I haven't come across a patient yet who, there's so many ways to graft, there's so many different types of implants we can use. There's just a solution of some type that we can find for almost everybody, and that's the God on truth. It's amazing, and that's where the technology is now, and that's what we're able to provide.
That's right. And again, that caveat is that if you're medically healthy and stable, we can do it.
Does it make a difference to you folks whether the tooth is missing because of an accident or because of decay? Is there a difference, or does it make no difference?
No, it doesn't make any difference to us why the tooth is lost, but we want to know why, because we want to correct whatever things that were done to create that loss. So whether it's grinding, whether it's breakage, whether it's decay, periodontal disease, whatever the underlying cause is very important, because we want to help alleviate or fix that. But besides that, how we treat the site, I don't think is very different in any of the aspects.
Yeah, and when you have a disease factor, unlike trauma, we do want to take care of the disease first. And often we can do that at exactly the same time as we rebuild. And that's one of the things that our technologies will allow us to do. And the sophistication that we have, that we can go in and we can compress the treatment time down because of our ability and the laser technology we have and how we can manage those tissues, that we can really compress the treatment time.
Now, you have everybody come through your clinic, people that are of legal age or that have been recommended by a family dentist. So we have young people, we have older people, we've got Tom, Dick, and and Harry, Mary, Bill, and Sally. But you guys also, and I won't ask you for names because I know there's patient confidentiality thing. But you've had some pretty famous people come and sit in your chairs too. You have sports figures. And,
Yep.
Yeah.
Let's put it this way: we see a lot of patients from a lot of different facets of people, different ages and places in life. But the one thing that I'll tell you is that we treat a lot of patients that are older than you think people that would want to get treatment done. So, to be honest with you, I have a case coming up that I'm really excited about. Where a lady who's getting something done for her 90th birthday.
No.
And it's going to be amazing. And it's something that I've been beaming about for the last 3 weeks, and excited about because it's going to disparage everyone's idea of I'm too old for this, and also the idea that I'm too old, I can't have this done. Those things, age is just a number, and it's one of those things where people are living longer and longer, and your quality of life is so much a factor that every single time. This week even, we did something for someone who's had a relationship in their mouth where they've had it since grade 8. They didn't like the way their teeth looked. It was really a tough situation. They've been around, and we did something for them in one day, and he walked out and he just said, I should have done this 10, 15 years ago. And we just put in a temporary bridge. It wasn't even the final one yet, and he couldn't believe it. It was absolutely fabulous.
It's because you perform magic, miracles. Let's say that this morning, listening to our show, we have some moms and dads, and of course we have some grandparents, and they have grandchildren that might be getting into the sports. Is there anything that they can do to protect their teeth other than just wearing a face mask? Because when you're playing tiddlywinks, the face mask is pretty stupid.
Mouth guards. Mouth guards, sure.
Yeah, they're really good.
4 mouth guards, and it helps dissipate the forces, and it'll make the difference between losing a tooth and sometimes being able to save it.
And don't give up on that. So some kids, for instance, they think they're too big. Sometimes they're too. Go and do some trial and error if you have to. Find one that works, because it really will save your teeth if your kid gets knocked or they fall or something. It will help a lot.
Do you need to go to your dentist to get one of those, or do you just go to the drugstore? Or where
You'll get a better one at your dentist than you will at your drugstore.
It'll definitely fit better, and it'll be a better situation.
Yeah, and what I'm going to recommend is just take a look at all those sports people. Take a look at all the hockey players. Have you ever seen one that doesn't have a mouth guard in their mouth?
You ever seen one with teeth?
But they still have a few.
But then they have an accident on the ice. They go and see you guys, and you fix them up, and they have teeth.
And they give them back a mouth guard afterwards.
And they give them back the mouth guard after.
Absolutely.
Name of the show is Boomer Life. It's BC Perio Dental Health and Implant Center. Our very special guests in studio with us, Dr. Bobby Birdie and Dr. Ron Zokol, a couple of great guys. We have some fun every once in a while when they come down to the studio, but they really know their business. And because it is the weekend, Dr. Zokol said I can tell the people about a free consultation.
You're allowed to do that.
Because it's the weekend.
That's right.
You can only give good news like this on the weekend. So if you want a free consultation, and believe me, you guys should charge for this consultation, I'm telling you, but don't get any crazy ideas. It would be well worth any money they were going to charge. Their telephone number is 604-872-0222, 604-872-0222. That's for the location in Vancouver at 777 West Broadway. If you live out in the Tri-Cities area and you want to drop by the Coquitlam location, it's number 250, 1175 Johnson Street. That's 250, 1175 Johnson Street. And the telephone number out there is 604-936-8244, 604-936-8244. You're listening to Boomer Life. I'm Tom Lucas. In studio with us, Dr. Bobby Birdie and Dr. Ron Zokol.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.
Missing teeth? Tired of your dentures? Not sure which dental solution is right for you? Dr. Bobby Birdie can help. A certified specialist in periodontics and prosthodontics, Dr. Bobby Birdie can show you your options and assist in determining if dental implants, teeth in one day, or implant-supported dentures are right for you. Book your free consultation at bcperio.ca. That's bcperio.ca. Find your dental solution with Dr. Bobby Birdie and Dr. Ron Zokol. bcperio.ca.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at shannonoaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
CI 650. Rush 'em till they're clean and bright. Rush 'em till they're pearly white. Morning, noon, and night. And then smile, smile, smile.
You know what? If you guys want to borrow that song, I'll let you put it on your website.
I love these songs.
It's not bad.
They're cool. I like them.
I always say there's a song for everything. Sometimes you just have to look. And there's a song about dentistry and about teeth and brushing your teeth and making them look white, white, white and happy, happy, happy and healthy, healthy, healthy. Dr. Bobby Birdie, let's say somebody comes to visit you here before we wrap up the show. Somebody comes to visit you. They've been to another dentist. The other dentist says, well, you should have an implant put in there, but you just don't have enough bone in your teeth, so I'm sorry, you're going to have to wear this plastic tooth for the rest of your life. Is that true?
I would say that, I think that if we take our measurements, take a look, it's going to be rare that we can't provide an implant therapy of some sort for someone. It may involve a little bit of grafting, which, to be honest with you, is fairly routine in our office. So, I think there are rare to almost no cases where we can't do an implant. It's only in very, very extreme cases, but then there's also other alternatives as well.
People need an extraction. You do that too?
Oh, absolutely. And people will say, well, can I get another dentist to do it? I say, sure, as long as that dentist is capable of doing what we call a ridge preservation graft, and we can hold the bone in place.
Ridge preservation, what does that mean?
That means it preserves the width and bone volume so we can put an implant in later. And if you take a tooth out and you don't do that, then you're going to lose 40-60% of it in the first 6 months.
I was going to ask you about that. So if you do take a tooth out, you have to replace it with something.
Yeah, you got to create an environment that's going to allow the body to regenerate all the bone back in there. And if you don't do that, then you're going to lose the bone.
And I think the biggest key to that is that you've got to do an atraumatic extraction. So, like one of the courses that Ron and I both teach is teaching dentists how to do atraumatic extractions, how to do something so that they preserve as much of your own bone as possible, and it allows things to come out so things aren't as aggressive and tough for you to heal, and things don't remodel as much. So to me that's the biggest key is doing something atraumatically.
What I like about your clinic, BC Perio Dental Health and Implant Center, is you're not only there for your patients, which of course you are, and you're there all the time, but you also have different dentists and doctors coming in from around the world. They look around your office and they come to you guys for advice.
And training.
Yeah.
Yeah. We have doctors from the East Coast in the U.S. coming all the way to Vancouver on every 2 to 3, 4 weeks for regular training programs.
Yeah, we've got people coming from all over the States and Canada and sometimes internationally that come in for our courses. We run them out of the Pacific Institute, and there's a lot of things that are going to be stirring on that side very soon, where we're going to be providing a whole lot of courses of different fields for all dentists everywhere.
Now, last time you were in, Ron, you were talking about getting one of your teaching seminars set up on one of those riverboats going around Germany somewhere.
Great idea.
Yeah, and I'm just wondering if you needed an MC for that special occasion.
We could probably find a position
I know
for
a guy. You think so? Okay, yeah. Well, I've been down to their office, and it's just a wonderful office. As I said before, all the doctors down there are just wonderful. The nurses are just fantastic. The people who work in the office are just wonderful. They'll take care of you. You've got a great view. You've got marvelous coffee. You can drink coffee until your teeth float, which is not a really good thing, but you can drink enough coffee until your teeth float. And then you go in there, and it's totally painless, and you sit down with everybody, and hey, it's weekend, it's free consultation time. I go and see the good doctors. Briefly, I sit in the chair with you. It's my first time. Hi, how are you? And then what?
And then we ask questions and talk about it. And we find out, as Bobby indicated before, what are your priorities? What are the things that are important to you? And let's see if we can find a solution.
Is anybody too old?
No.
You mentioned the 90-year-old woman a second ago. Is she one of your oldest patients?
No, I've treated someone who's older than her as well.
Really?
Yeah, likewise.
Yeah, I remember. Didn't you treat a fellow once?
94.
And he was going on a cruise after.
Around Germany, right?
Yeah, exactly. Down the Rhine, right? Oh, well, you guys, you just excite me. I love talking to you because you're excited about what you do. You have a passion for it. I feel this strongly about what I do, and I'm glad that you guys feel strongly about what you do.
Mm-hmm.
Yes.
You're going to keep doing it?
For a long time.
That was a trick question for Dr. Zokol, because I I have a suspicion that he might like to find himself a piece of land somewhere and retire, but I think he'd be pretty bored.
It's not going to be for a long time.
Boy. So if people want to get in touch with you for their free consultation for this weekend, it's BC Perio Dental Health and Implant Center. BC Perio Dental Health and Implant Center. They'll put a smile on your face, fix your teeth all up, make you look like $1 million. 501-777 West Broadway. That's at Willow Street in Vancouver, 777 West Broadway. The telephone number, 604-872-0222. 604-872-0222. In Coquitlam in the Tri-Cities, it's 250-1175 Johnson Street. The telephone number is 604-936-8244. 604-936-8244. Before we go, Dr. Birdie, how's the little one in your family?
He's doing great. I've got a little 3-month-old at home now, and he's a lot of fun.
Is he doing fillings yet?
No, not yet. I haven't taught him yet. Trying to take it easy.
You haven't bought him one of those little plastic dentist sets?
No. Not yet.
Our little granddaughter, her aunt, she's going to be turning 5 soon. They found her a doctor's outfit at the Scrubs.
Oh, wow.
So, boy, oh, boy. Maybe she can get a part-time job down at your place, bringing the little kids. Guys, say thank you so much for coming by.
Thanks so much.
Tom.
And if you want to go down and see Dr. Ron Zokol or Dr. Bobby Birdie, please give them a call. You can call them today, leave a message, or give them a call Monday morning at the office in Vancouver, 604-872-0222, 604-872-0222. In Coquitlam, it's 1175 Johnson Street. The telephone number out there, 604-936-8244, 604-936-8244. Gentlemen, it's always a pleasure talking to you. Keep smiling. We'll find some more tooth songs for next time.
Thank you, Tom.
Perfect.
Have a great weekend, you guys.
Thanks much.
Thanks so much.
Take care.